The use of video technology has come into its own. For some doctors' visits and consultations, we may now not even need to leave the house. That's right, we can have that appointment directly on our home computer. With video conferencing, such as the software application Skype, practitioners of varying degrees are connecting to patients further and further away. Joining us now are plastic surgeon Dr. Spero Theodorou and his patient, Christine TRAVERAS. Welcome to all of you. Thanks so much for being here.
Thank you.
Thank you. Let's start with you here. You use Skype for your SmarLipo practice here in New York. How did that come about? You say your patients asked for it, is that right?
That's correct. When we first started our Park Avenue SmarLipo group with my partner, Dr. Christopher Chia, we wanted to bring the latest technology for our patients as far as medical procedures were concerned. However, the traditional way of bringing the patients into the office was something that our patients started asking about us, since our population of our patients tends to be a lot younger. They practically live on the internet, and they're the ones that take all the credit for this idea. So,
and you use it as an initial consultation, is that right?
Correct. We use it essentially as a screening tool.
Okay.
There's a lot of information on the internet out there, and it's very hard for people to decipher it, and there's no substitute for a face-to-face to learn more about the procedure and certainly to be educated more about the pros and the cons of what they need to do.
So it's not obviously a medical examination, it's just a screening tool to see which patients are good candidates.
That's correct.
For the procedures they're looking into. And Christine, can you tell us a little bit about your experience? I understand your first consultation was through Skype, is that right?
Correct. I was looking for SmarLipo. I was looking all over the internet, doing my research, my due diligence, trying to find the best practice in New York, and I found Park Avenue SmarLipo. The most important thing to me, though, was time. I don't have a lot of it. I don't have time to travel, to go to a doctor's office, sit in the office, wait for the doctor to see me in between his schedule. I had meetings all over the place, 6 days a week, and I saw that they Skyped. And by doing that, that enabled me to sit in my office, take 15 minutes, and actually discuss my concerns and my questions with the doctor before coming in.
So you weren't apprehensive. You thought, hey, this is great.
I thought it was fantastic.
Yeah.
I use it on a daily basis doing video conferencing and for work. So I thought, wow, if I could actually have a conversation with a plastic surgeon, why not?
And you're 3 weeks out of a procedure, and
yes.
you say you're thrilled,
and
right?
I'm down a size already,
oh.
So I'm thrilled beyond belief.
Well,
Thanks to Dr.
congratulations.
Theodorou.
You look
Thank
great.
you.
And I just want to follow up with one question to you, Dr. Theodorou. This is not something then that you use in follow-up visits, is that right, or do you?
No, most of the time we use it as an initial screening tool, providing education to our patients that are prospective patients. Once they've established sort of a relationship with us, they tend to like to come to the office because it's their home now. And they feel a lot more comfortable there.
They feel part of the family. All right,
That's
Christine,
correct,
Dr. Theodorou, Dr. Olson, thanks to all of you. And direct personal therapy, medical advice, and a whole host of services can truly be just a click away. And while you're at it, you can click on our health page.